So tomorrow I'm having my 28th surgery related to my rare genetic disease, and I'm pretty nervous about it. I've had a lot of surgeries. Obviously, I've had 27 so far. I've had some pretty major surgeries as well, including hip replacements, ligament reconstructions, and surgeries on the nerves. And for the most part, I typically do get nervous, but only do I get even more nervous when there's a risk of, like a higher risk of complications, and that's what's going on with my elbow surgery here. So I am having an elbow arthroscopy to clean out my elbow, debride it, get a good look to see what's going on, and if there's anything else that needs to be repaired. But I have had surgery on my elbow 3 times prior to this, and one of those was to have the nerve moved to a new position in my arm. And when this happens, it obviously changes the anatomy of the elbow a little bit because the nerve typically runs through a normal spot. When you have the nerve moved or transposed, they put it to a new area in the arm. And so when you go back to have arthroscopy like this, it can be sometimes hard to identify that nerve, which makes it a little more high risk for some nerve injuries. I trust my surgeon. I know that he will, do his best to get the nerve out of the way and everything like that. But, there is just a high risk, and it does make me nervous because it's my right arm and my dominant arm, so nerve damage would not be fantastic. But I'm doing that tomorrow. Fingers crossed that everything goes okay, that there's not too much damage in my elbow, and I come out in a lot less pain and no nerve damage. But I'm pretty nervous about this one, but I will keep you posted throughout the journey.